All right. Now that you guys are here, I want to dive a little bit deeper into this movement mobility assessment and tell you guys a little bit more about what you can expect when you come in. So, when you come in for this movement mobility assessment, we're going to bring you through a what we call our top tier assessment. Where we're going to watch you do a bunch of different global movement patterns and see what your quality of movement looks like. And these patterns oftentimes incorporate a lot of different movements kind of all at once. And your ability to do that either successfully or not successfully gives us good direction as far as where to go next. Think about this as taking all the different possible potential things that could be going on with you, and we're going to simplify that down to just one or two things that we think might be the root cause or what might be causing your pain or problem area to be existing in the first place. So, if you saw our video before describing the movement and mobility assessment, we talked about our IQ method, where we have incomplete joint mechanics, instant level pain, and injury. And we describe this as being a sliding scale. Injuries, pain is not black and white, guys. It doesn't happen and then not happen. At any point in time, you could be so dang close to being in pain and you just don't know it. You might feel good, but man, that one time you bend over, you were so close to this instant level pain versus somebody who just has a couple minor incomplete joint mechanics that pushes you over the scale, and now you're sliding more towards this injury thing. Whereas, now you're in a little bit of a acute pain or subacute issue that you have going on. So when you guys come in for this assessment, we want to figure out, number one, what's causing this, what's making you slide from just incomplete joint mechanics to instant level pain, and obviously we hope that you don't currently have any kind of big severe injury going on either, but we want to find out what's causing that. And we always follow our 3-step process, and that's what I really, really want to go over in this video here. So when you come in to see us at Leverage Chiropractic, we always tell you we use this tried and true 3-step process. Number one, the first thing we have to do is we got to get you feeling better. We got to get you completely out of pain, because um, when you're feeling good, step number two in fixing the ultimate root cause of the problem just gets that much easier. It's really difficult to work around pain because pain is complex. So that's why, regardless of where the root cause is, we want to get you feeling better, and not just feeling 100% better all the time, but at least get you to a point where you know what you can do outside of our office to help alleviate some of your symptoms. Then you don't have to become reliant on us to do that. So step one, get you feeling better, which is great. So that's what you're here for, right? Step number two, and arguably the most important step, is we want to fix the root cause. Now, I'm pointing to this incomplete mechanics here because just because you have pain, and that pain might be in your low back, it might be in your shoulder, it might be in your knee, just because you have pain in that area does not mean that's where your pain came from. Oftentimes, and actually most times, it's from an incomplete mechanic either down or upstream from that problem area. So if we don't find and fix and address that root cause, this is something that's ultimately just going to keep coming back over and over again. How many times have you guys heard this where, oh, I went to go see my chiropractor and I felt good for a day or two, but then it just kind of came right back? Or I tried physical therapy and I was feeling good, but then when I stopped going, within a couple months, it came right back. That's because this step number two, fixing the root cause, actually finding and addressing the root cause away from the problem area, is really, really important to make sure that this thing goes away forever. And then step number three is just that. We want to teach you how to own your health, give you guys things that you can do, actionable things that you can do at home in your own time to fix this thing forever and make sure that it never comes back. Our ultimate goal is to build a more resilient you and get you guys moving good and feeling good for a lifetime.